So I prove that right here. Got this from Ken in Arizona. Number one asshole. I'm your number one asshole. All I want the government to do is follow their damn rules. They're very fair, good rules. Okay. Turn off your cell phones, folks. Okay. All right. Let's start off with Christopher from Minnesota. Veteran. He's talking about his son. He's going to, okay. Was in the Army, hurt his back, discharged with, and it was citing pre-existing scoliosis. Okay, great. If you have pre-existing, that means any kind of thing in the service is going to aggravate that. And if it's aggravated that much, it's VA compensable. If you went for the government and it's aggravated a pre-existing condition that much, it's more compensable. Like if you come in with flat feet, it's going to get worse. You come in plantar fasciitis, it's going to get worse. Easy. Now they're going to fight it, but you're always going to win if you don't give up. Because he struggled with his back, and so he needs to get a VA claim, and he's working with the federal government and probably needs to file for his back on a federal claim. You get to double dip. Okay, here is Todd, Air Force veteran, chronic lymphocytic leukemia, aircraft technician. Gee, I wonder if you were around any solvents, gas, oil fumes, gas fumes, jet fuel fumes. All those are carcinogenic. Okay, it's not criminal law, but it's good enough for VA. You don't have to go into just an Agent Orange or a burn pit. Although the back end of an aircraft is a burn pit. Think of it. It's a burn pit. So the same logic you do for burn pits should do for the ass end of a jet. All right. And now here is get started my paperwork. VA claims don't know what to start. Okay, you go to ellisclinic.com. You go to appointments and you pull up VA appointments or workers' comp, federal workers' comp appointments or Social Security, whatever. And then you just start filling those, start looking at them and you write down the claims you want to file for. And then records and it's all there. It just tells you what to do. You send it in, and if it's not enough, we'll call you and tell you, well, let's get this, let's get that. Or you come in and we'll do it after. Okay? Help get the records. So don't try to get in this administrative law by yourself. Let us walk you through it. And my staff, they love you. They'll take care of you. Here's Vicky from Florida. Nexus letter for she's on CPAP, so she's got sleep apnea. And we tied it to tinnitus, which there's a lot of case law on that. And then they sent through the VA doctor. It was very nice and only wanted to see my last sleep study. Didn't ask her anything. Son of a bitch. Wish I knew his name. I'd tell it out right now. Okay. And of course, he was denied. Even if he did do it, it'd be denied. So looks like you're getting some more stuff. So if you get obesity done, let's do it. You're at 87%. Let's get the sleep apnea. Let's get it. And let's do it by tele. If we've already seen you, let's do the next one by telehealth. Even if the first one was telehealth, let's do it. Because you just need the rating and the magic words from a white coat. Pretend like I got a white coat on. Okay. This is Texas, Regina. This is workers' comp, federal workers' comp appears. Shoulder surgery, recurring dislocation, unrelated to his workers' comp claim. When she went to work, a coworker bumped her, aggravated her shoulder. That shoulder, and 100% of it is covered under workers' comp. You just need to get the medical rationale reports proving it, which most doctors haven't got a clue how to do. Okay. So you filed a workers' comp claim, exhausted your leave. We can buy that back. What now? You said you weren't offered the 40 days. That's 45 days of continuation pay. If you file a Form C1, which is an acute injury, you should get that 45 days full salary. They just screwed you. If you file a CA2, you don't get that. Then they didn't screw you. But we get those dates off. We get them paid. In fact, my paralegal just told me we just got a lady $70,000 back pay. And the law firm that worked with them couldn't do it. And we didn't charge her anything. Okay. I did not apply for a scheduled award. or undergo a maximum medical improvement assessment. Folks, there's no such thing as a maximum medical improvement assessment. For instance, let's say your shoulder, and we're doing physical therapy on you, give you injections. That's not going to change the condition, even though you're getting active treatment. It's not going to change the condition. If you have surgery next week, you're not at maximum medical improvement. So even though you're getting treatment, you can be at maximum medical improvement. A case in point, the doctor did 5 knee surgeries under federal workers' comp. Thank you very much. He didn't have to do copay. Thank you, doctor. When will I be at maximum medical improvement? Now, this guy means well, but he has no training. Keep your damn mouth shut, doctor. All right? And well, never. You're always going to need physical therapy. No, that would have cost him over $300,000. He's ready for scheduled ward for that knee, even though you're going to need continued maintenance physical therapy. Okay. And then maybe you don't want scheduled ward. Maybe you want to be on temporary total disability until you die. It's the same amount of check each time. Okay.
We have a question here from Gwendolyn on Facebook asking if there's a statute of limitations. I'm assuming for filing.
Yes, there's statute of limitations. If you're filing actually acute injuries a year, but actually you can file in 3 years. But if you don't file a CA2 cumulative trauma like carpal tunnel within 3 years, then there's a statute. You lost it. Okay. But here we have a shoulder that was pre-existing, you got aggravated, and you've got a claim number, and then later it gets worse, we can still reopen that claim for a scheduled ward to put you on temporary total disability. The rules are very fair if you can get anybody to listen to you, and that usually means appeals to a higher level, which will help you do. Doesn't cost you anything. And they didn't tell you anything. Employer provide minimal guidance. Hey, that's not their fault. They're not trained. Okay. And there's a bias against the injured litigant. Can you imagine being a supervisor and having all these people with all these restrictions and having to go through that morass? They want you going. So they closed it in 2011. That doesn't mean it's closed. It just means that you need to reopen it. Federal workers' comp claims never close. They close, but you can reopen them. As worsened would cause me constant fear and discomfort. Of course, it meant day life and sleep. Surgery is not an option at your age. I agree. So that's all covered. We can get all that stuff taken care of. Now you got some other questions. 8 years later, another workplace incident, lifting. That's a back. But you got a scheduled ward, 2% for back. That's not bad at the time. I assume it's worse to go do another scheduled ward. That's from the second opinion, Dr. Department of Labor. Now, think about it. If an insurance company sent you their second opinion, a doctor, then that's not fair. Okay, but the government sends you to a government doctor for a second opinion, who gets paid a lot more than I do. So guess what? He's not going to find anything because he wants more business. He doesn't care about you. Okay, so now ankle injuries, that's a new claim. Given the complexity of interconnected natures, okay, it's complex to you, it's complex to the government, it's bread and butter for us. We'll just walk through it and take care of it. Throw me one of those ducks. Give me the big duck.
You got it.
Okay. The thing in legal medicine is what's the duck? And the duck is a hunter flies in, buys a hunting stamp and a duck stamp, pays the farmer, shoots ducks on his pond, shoots the duck. He reaches down, gets the duck. Farmer puts his foot on the duck and said, "It's my duck." And he said, "Well, look at my licenses. Yeah, you die. Look at this." Like talking to the government. Don't bother me with facts. The way they settle that duck argument, they flip a coin. The winner kicks the other guy in the balls and said, "It's your duck." So the question is, what's the duck? So what we do with all this complicated stuff, we find out what are the ducks. This is what we want. Now let's go after it. And we don't worry about all the other stuff. And we focus on the duck. And my staff is trained to do that. They can get through the horse shit. Okay.
Now, before you move on, I
Sure.
want to share some fanfare from give me a second. I wanted to share some fanfare from Tona on YouTube. She is giving you high praises, and the latest comment she makes is And if it wasn't for your illegal medicine, my husband and I would probably have lost our home this month. Now I can pay bills.
That's why my people still work for me. If I was on horrible bosses, I'd win because I'm an asshole. But the reason the staff stays so long and it's because they get so much love like that. Okay, they can't leave. They're stuck here because they're finally doing something that makes a difference. You keep your house, you get fed, and I keep you out of jail. I've done 1,587 trials and depositions, including federal criminal court, when the government comes after people asking for 5 years in jail and a $250,000 fine, and there's not an attorney in the United States that can defend them. But every time I've done that, within 15 minutes, the judge has threatened the prosecuting attorney with contempt or jail. Prosecuting attorneys, if you take one of my people to court, you better pull up my transcripts and read what's going to happen to you. You don't want to mess with this crazy guy. I know the law. I teach this. I teach judges. I teach law schools. Okay. Here is Leroy from New York. Not getting paid by OWCP. Never heard of that. Like I just told. Letty just got $70,000. Okay. Denied my request for permanent disability. That's probably returning to work. Or restrictions for work. You may be talking about an impairment rating. Your lawyer has nothing to do with that scheduled award. Okay, so when 5 months, no, that okay, 5 months out paid. Let's get that 5 months paid for you. Okay, doctor wrote a letter. Well, he's not going to be able to do that. I'm licensed to do brain surgery, but to be malpractice, I'm not trained. He's not going to be able to do that. Okay, and now here's typical. This is typical, folks. In March 27, I applied for permanent disability, which would be a scheduled award. Harris Federal is a good law firm, by the way. My agency held my paperwork for 6 months. I hear that all the time, and it's not just an accident. It is fraud, okay? Because no one gets their hand slapped. If an insurance company did that, you get a $40 million bad faith claim for punitive damages. Okay. They lied. Of course they do. That keeps me in business. And then they discard the hand surgery statement. And the supervisor is not a medical physician. And they just blew you off. That's normal. Come in, let's fix it. Okay, here is Clarence from Texas. I looked through your previous answered questions. Just ask new ones or give us a call. You don't have to go through all those silly videos. Hearing claim, Department of Labor was approved. The doctor, the DOL doctor rating didn't get scheduled award. Well, let's do another autogram. Let's do another scheduled award. Okay. Yeah, and so yeah, you were in Bosnia too. Okay, you've got hearing loss. Now, hearing loss is real simple. You take the audiogram and you do the math, and whatever the AMA guides say, that's what you get. But they're gonna send you somebody else that's going to change it. Now, if it's a VA hearing loss, let me give you a warning. I've had people with hearing aids and 30% impaired under the AMA guidelines. Let me tell you what I'm talking about. This book is the latest one. American Medical Association Guides Evaluation of Impairment. And yet under the VA system, they would be rated at 0 because they take the audiogram, which is 30%, and then they take what's called speech discrimination, how well you understand words. And it's on that one, it said has 96% word recognition. Hell, I'm yelling at him. He can't understand. I put my hands over my mouth. He has no clue. And this audiologist said 96%. That's outright fraud. And what they do, they keep saying the word over and over again. Do you finally say, I understand the word? This is not an IQ test, folks. It's supposed to be on a Maryland CNC. Now, I'm going to hang one of these audiologists one of these days. We're going to file a Bivens complaint against him. He was their federal employee. And that's a bad thing. They can pay their own attorney fees and court costs. I'm just warning you audiologists out there, if it's my patient, you better be honest. And they get one chance at it. If you didn't understand it, you say, I didn't understand it, ma'am. Am I supposed to call the OIG? This sounds like it's your voice. Doesn't sound like it's from a CD-ROM. It sounds like the voice you're talking with. That's fraud, ma'am. This is an office for previous back injury, no problem. In fact, you've got a claim number. You filed a CA1. Even if it wasn't accepted, you filed it. If you filed it, they'll sign a number. That doesn't mean it's accepted, but you filed it. And so we can just take it from there, provide the history, and print it in the medical rationale. I know this is scary, guys. I know it's because no one knows what the attorneys don't know this. Doctors don't know this. I know it's tough. Now, here we have Marcelino from Florida. I'll come visit, okay? 100% for a whole bunch of stuff and try to get aid and attendance. Hey, let's get at ellisclinic.com, print out a VA appointment, write on, would like to get aid and attendance, and help for you. And let's try it on, and let's try a phone call. And you'll send the records, and then we'll do it a phone call because the records speak for themselves. I mean, your impairment rating speaks for itself. And because the VA, wherever your VA is not going to help you. Some VA raters are really good. Some are terrible. Because I only see the ones that are bad. Okay. Measy Miami. Okay. Got my next letter. They're waiting to see what the VA says about sleep apnea, secondary chronic sinusitis. If they turn that down, we're going to win that. Okay. Okay, that's yeah. You got approved for chronic sinusitis, migraines, tinnitus. That's covered. What to get rid of my flat feet and I'm an Amarillo. Let's try that on. We'd always do a phone call. So let's say you pay $500 for flat feet, $500 for condition, and you get it. Then fine. If you don't, then you come another $500 and you actually see you and rate you. But obviously, running around in the military with backpack on and combat boots, if you had pre-existing flat feet, it's going to make it worse. And if it makes that much worse, under VA, it's covered. Yeah. But everybody's going to fight you. But good, like I said, that keeps me in business. Okay, David, asbestos exposure, and you've got COPD, pulmonary fibrosis. Wow, you need to get that covered. Yeah, first of all, you need to get the asbestos exposure covered. So if you ever have cancer, the widow gets a pension. Okay. And then you need to get a rating. I don't know if you're VA or whatever you are, but you get a rating. For instance, there's a shack up at the Boeing plant in Wichita, and it had shingles on it. And the safety department had some guys go take those shingles off. They're asbestos shingles. Shit. So there's dust all over the place, and they're panicking, and they have lawyers, and I go up meet the Baptist church, and I said, now, you've got to file a workers' comp claim for asbestosis, so you get your what's called a Class B X-ray. It's a special kind of X-ray, special rating. They follow it, okay? Nothing ever happens. Now, if you're a smoker, you have a 50 times greater chance of getting lung cancer. Listen to me, kids. Now, if you're a non-smoker, you have, it's maybe a 5 times greater chance of getting lung cancer. And lung cancer is pretty rare, except in smokers. Okay. But now, you, sir, have a daycare in your house. That's a personal injury. No kids can go in that house. You need to tear that house down because you brought in fibers just like the guys working on chips did. That house needs to be condemned. You can't live in that house anymore. That's big bucks. So you get a real asbestos attorney for that personal injury. I'll testify for you, but yeah. So you want to get it approved, hoping nothing ever happens. I had another case. A whole bunch of people were exposed to asbestos, and I think I did 15 depositions in a couple of days. And every one of them, I said they have asbestosis. Impairment 0. Because they have the findings on their lungs. Yep, they have asbestosis, 0 impairment. But if they get most kinds of cancers, then it's going to be covered. And so I did that over and over and over and over again. They've got it. Hopefully nothing ever happens. but you want that diagnosis approved. Yeah.
We've got a question here from Oliver on YouTube. I've been having episodes of vertigo due to service-connected hearing loss, tinnitus, and migraine headaches. Can you assist with a diagnosis?
No, I believe you have vertigo. That's a symptom. Okay. And that's consistent with tinnitus. It's consistent with migraines. And you can be rated for it, separate from the migraines, separate from the tinnitus. It's not a diagnosis like cancer or broken bone, but you have that symptom, and that symptom is rateable. And that's easy. Okay. Okay. Now, okay, here we have Kat, medic retired a year ago, non-work related injuries, have carpal tunnel, both wrists. Okay. Okay. You can file up for 3 years. So let's get this going. What you want to do, you have to have an employee statement. You can go look, you can Google OWCP carpal tunnel, and then up will come a form, a 35G, whatever the carpal tunnel is. And you look at what you want. Better is make an appointment at the Ellis Clinic, come in, and we will guide you through your employee statement. Okay, we'll read what's required by the law, and then we'll help you understand and let you go in, and you'll dictate it. You won't have to write it down. You don't have to do essays like in high school. You write it down, and our AI will print it out, and you'll have a really good employment statement. And then we'll provide a medical rationale report. Now, this is what's interesting. I had a claims examiner. Claims examiners are the judge and jury in federal workers' comp. They only need 12 year education. Was saying, well, it looks like Ellis Clinic helped with the employee statement, as if that was bad. Now that proves that person has a bias against the injured litigant. So if you have a lower IQ or you have language skills, tough shit, come on, you're supposed to help these people. It's that law, the federal law for the VA and federal, is supposed to be non-adversarial. It's more adversarial than a damn insurance company, because you can't go after the claims examiners and the VA raters. Of course, it keeps me in business, but it's just what the government does to veterans and federal employees. You guys have not seen what's going on. It'd be like if you were in World War II talking to how the Jews were treated in Germany, and you'd not gone across the ocean yet, and you the channel, and you had not seen the ovens in Auschwitz. Now, goddamn it, I see ovens. And if you think I cuss, this is not enough, because this is what I see. All these pins on this map are being treated by the federal government and put in the ovens. And I don't tolerate it. So I'm just warning any prosecuting attorney, you better have your ducks in a row, or I'm going to eat your lunch. Because I know the law, and I know how to apply it, and I'm not going to tolerate this. So I had a deposition that guy came that said, you don't like U.S. attorneys. No, I don't like stupid U.S. attorneys. But if you apply the law, and then afterwards, I told him, I said, listen to this, you'll never hear this, attorney, from a doctor. I love attorneys. I gave him a hug. Of course, that case was dropped. Okay. Okay, here.
Putting that on screen for you, the actual excerpt from.
You don't think I'm very much of the Department of Justice lawyer. Yeah. No, Ron White, who is my 13th apostle, blue collar commentator, my Scotch and cigar guy, he said one of the wisest things I ever heard: you cannot fix stupid, which added 10 years to my life. So a lot of times I'll see a second opinion report from the VA or a second opinion report from a district medical advisor. I just go to the last paragraph, and when it says 0, I don't have to read this, do I? Okay. Okay. So Kat, you got to file this stuff, and if it's close to the date, just file it and fill out the CA2 form and get started.
We have another question from Reg on YouTube. Please advise if my employer refused to sign my CA2 to reopen my case because the incident happened years ago before they were my supervisor.
Supervisor didn't know shit. E-competent yourself.
All right.
And then, or mail it. The e-comp. If you don't have an e-comp, that's how federal people can talk to the federal government. If you don't have an e-comp account, call us. We'll walk you through, set up your e-comp account, and then you send it in. Then they'll send it to the supervisor to sign it. because he's now he can say I disagree, but that supervisor is absolutely wrong. There's nothing to do with him. It's the agency you're suing, not him.
We have another from Leander on YouTube. Can you service connect obesity to heart valve replacement and bypass and hypertension and anxiety and sleep apnea?
If you had the obesity first, absolutely. And if the obesity was caused by a bad foot, a bad knee, for instance, let's say you have a foot or knee that just a strain, not even arthritis yet. When you lift boxes, you always see the picture how you're supposed to bend down and pick the box. Well, if you can't bend your knee, then for the rest of your life, you're going to be putting extra forces on your back just because you can't bend and do the normal lifting. And of course, if you're a nurse, they don't make patients like those boxes. So you're always going to hurt your back if you're a nurse. Yeah. And that's all the rationale you need in federal workers' comp VA. This would not work in many state systems, which require 51% assurity that that's correct, or for criminal law, it's beyond a reasonable shadow of doubt. Right? And doctors with no training, I started doing this 50 years ago. Percentage of the loss of the ability to ordinary manual. We doctors have never heard of that. Yeah. So anyway, so I've self-taught for years, and now I'm the teacher. All right. Okay. Here's Kevin from South Dakota. Social Security, a physician assistant. Because had quit severe right leg pain from knee and toes. Okay, complex regional pain syndrome. Oh, God bless you, man. God bless you. Okay. Pain progressed. You can't work. It's going to be hard to get Social Security. Now, the Social Security turns you down 90% of the time, and it's going to be hard for Social Security people to understand complex regional pain syndrome. Folks, I'm so old. We used to call it reflex sympathetic dystrophy because no one knows how terribly painful that is, that you can't even wear shoes and socks and stuff like that. So if you need we can do a Social Security opinion on that if you want. Okay. Yeah. But to apply, now what Social Security likes, they just like everybody's records and then adjudicate. But unfortunately, doctors don't write in the records whether you can work, whether you can do sustained gainful employment. Those magic words are never mentioned in medical records. So you may need those. Okay. 100% service connected from that radiculopathy. Good. And then combat PTSD. Wow, you must be a Christian going through all this crap. Okay. All right. Okay. Yeah. So give me a call and tell them that I said on this YouTube that since you're a physician assistant, I'll do the Social Security exam for free. Help you out. Okay. And here's James, active duty, military police, K9 handler, God bless your heart, Coast Guard, security, 10% for tinnitus, sleep study. Okay. There is case law and medical literature that contributes to sleep apnea. Wonder if you have anything else from the VA? Anything in your back, hips, or knees, or ankles? Any obesity? Any PTSD? PTSD certainly contributes to it. Okay. Oh, you have a high BMI. Yeah, let's take a shot at it. And let's do it. And let's see if we can't do a television, phone. And then if not, you come in. Yeah. Oh, you also have insomnia, depression, anxiety, and debility. That means you don't have rapid eye movement sleep. That contributes to sleep apnea. Okay. And you have headaches. There you go. Yeah. Let's get you taken care of. Yeah. Let's do that. Okay. You were attacked by a security dog. You probably have some PTSD from that. Okay. You can file for scarring for the dog bite. There may be weakness and it may be weaker stuff in the hand that's doing that. Okay. No, your buddy wrote a note for you. But if you tell me I believe it, that becomes medical evidence. Oh, the way they say it's not, they have to call you a liar. Huh? Well, we got everybody taken care of.
All right, let's redirect to talk about exactly how you got involved, for any new viewers, and why you do this, because you've talked a lot on the various aspects and how angry you get at it, but what led you down this path?
Okay, of course, medical school, drafted, flight surgeon. Thank you, Lord, for being drafted and becoming a flight surgeon. Then internal medicine in the Army. That was just great training. Well, thank you. That was great. And flight surgeon is kind of introduction to occupational medicine. So I was a small town doctor and loved doing that, being a football team doctor, delivered babies. God, that was fun. And anyway, I deliver an attorney's baby. Doc, will you see a state workers' comp claim and rate them for the percentage of the loss of the ability to do ordinary manual labor? I said, what? Yeah, okay. So I did a literature search. There's nothing out there. And I called the American Medical Association up. And they just come out with the first edition of the AMA Guides for Rating Impairment. And you rate things like how much a body moves, and think how much how much body moves, and you get a percentage. So I rated this person 19%. At that time, there was a orthopedic surgeon that would rate you at 0% for an operated back with rods in your back. You heard that? Rate you at 0% with an operated back with rods. Because he said, well, the surgeon made him well. They asked him at a cocktail party, why do you always do that? He said, you can't get any snide. He said, you can't get any lower. Then we have another doctor. They went there, took the silicone breast implants off the market, had the black market in for Brazil for his go-go girls, okay? He'd write 50%, didn't matter if strained or operated back. Neither one of them touched the patient. Just pure lies. The reason it's hard for me to get people to do legal medicine is the other side's going to call you a whore. Especially if they are a whore, they're going to assume you are too. Okay? So anyway, and so I rated 19%, and it went to the Supreme Court of Oklahoma, and they said, wow, guidelines. And my report becomes case law. Everybody's going in Oklahoma, is going to a little town south here called Pauls Valley to see some hick doctor. And then one day I'm walking down the hall with John Moore, great doctor, small town doctor. These guys never turn anybody over collections. I mean, they're just hearts of gold, like you expect small town doctors to be. Anyway, now, John, if you do much of that workers' comp stuff, you'll be known as an attorney's doctor. I said, oh my God, I'll lose my salvation and go to hell. A couple months later, wait, I'm good at this. And this is needed. In fact, over 50% of litigation, like VA, Social Security, workers' comp, and state, federal, requires a white coat. And we have no training. So it really messes the system up. The classic case, company truck, company driver, wreck, broken neck, neurosurgeon, fuses the neck. Insurance company needs the doctor to say if it's work-related. Well, obviously it's work-related, but a doctor has to say it. You fell off an 80-story building. Yeah, that's work-related, but the doctor has to say it. Okay. And the doctor wrote, I don't know. I didn't see the truck roll. So anyway, so I started doing that. And like I said, I've done over 1,500 trials and depositions. My testimony's never lost a case. Become the expert because I really enjoy going to court. I really enjoy teaching. I really enjoy telling the truth, and that's the secret. Just tell the truth. Like one time we had a video in my office, and so we have the insurance company attorney and the ambulance chase attorney, the plaintiff attorney. And the plaintiff attorney said, take my referral letter and take it out of the chart and put it in your drawer. I said, you don't want to do that. Oh, yeah, I do. I went to law school. I'm blah, blah, blah. Because he's ashamed that he had to hire a doctor to give medical evidence. He's ashamed of that. And everybody's ashamed of that. Hell, I'm proud of it. I teach this stuff. And if you're just an orthopod, what are you doing in here? You need to have legal medicine training if you go mess around with the courtroom. So anyway, of course the respondent attorney, sharp guy, and he'd already gotten all my records, and had seen that letter. Is that your entire chart? Well, no. What's missing? Well, Joe Blow's referral letter. You told me to put it in the story. You want to see it? Because he thought, oh my God, I've lost the case, and he would have. Okay. Now, but then during the deposition, the attorney said, what records you viewed? I said, they're on page 3 and 4. I've made a list of all those records. Now, in my report, in my chart, it says records produced by other entities are not kept. Okay. He said, well, I want to see XYZ record. I said, I don't have any. He goes, you don't have that record? I said, stop right there. You cite a reference that I need to keep any record, including my own, or we're not going on with this trial. No, I'm not. No, stop. You have insinuated that somehow I've done something wrong by not keeping that record. You have to cite me a citation. That may be what you think, but your thinking ain't the law. Now, no, we're going to cancel the deposition. I'm going to go for the judge. I'm going to get a ruling on whether I'm supposed to keep anybody's records. Now, you've got a whole briefcase for those records. He's got a whole briefcase of those records. Once you apologize for the tone of your voice, then we will go on. Otherwise, this deposition is over. Now, folks, listen to that. Doctors, listen to that. There's so many pearls I can give you that law school and medical school don't know, because I've had this 50 plus years of experience. And these people just pontificate on stuff they think, and they don't have a citation. Call him on it. So anyway, he backed off, and of course he won the case. I said, the next time I tell you something, you're going to listen, asshole. And he will. Yeah. Okay. So I just like doing this. Now, a lot of people compliment me for going to bat for him, and that makes me mad. I appreciate the compliments. That should be normal doctors. I mean, a Marine's going to go die for you. If a doctor's going to go help people and fight illness, you need to put your life on the line. You need to put your reputation on the line. You need to put your license on the line. You need to go help people. I should not be complimented for doing that. It should be normal. A lot of doctors don't care. They're just in for the money.
All right, Doc, we have a question here from Joshua Sparks on Facebook. After having a scheduled ward evaluation from your clinic, about how long does it take to get the result back so I can send it to the DOL from a OWCP claim?
You should have that within 2 weeks.
Okay.
Yeah.
So we have another here from Oliver on YouTube. Would my vertigo episodes be associated with Meniere's disease?
Meniere's disease is vertigo.
Okay.
Yeah, if you've got Meniere's, and that your vertigo has actually got a diagnosis, it's from Meniere's disease.
We have another here from Tona on Facebook. Is schedule award considered taxable income?
No.
All right. And we have just a general comment from Bill on Facebook. School them, doctor.
We're starting a legal medicine institute.
So you've spoken a little bit about this in your explanation of answers on the various questions, but and also the going to bat. But let's talk about the bias specifically. And it's to no fault of their own, and how the law is written to be fair.
Well, now the VA law, the federal law was the first, 1916 was the first workers' comp law. And it was obviously the government when made it very fair. The Employee Compensation Appeal Board, which is your Supreme Court in federal workers' comp, said it was obvious the government understood that the individuals taking on the whole federal government, when in doubt, it's not equal. It goes to the employee. When in doubt, it goes to the employee. And VA is the same thing. But in practice, the opposite's occurring because they have the bias. Heck, when I started doing this 50 plus years ago, I thought 60% of my patients would be legitimate honest people. And that 40% might be a little flaky. Now, amongst normal doctors, just normal doctors, not insurance company doctors, just normal everyday doctors, that may be pro-injured person. Because we're so damn conservative, we would rather 99 people be denied a claim than one trick or trick us because of our ego. Like we would rather have 99 people with pain not get a pain pill than some drug addict trick us. And then, of course, at the end, you talk about pain, and now you got all these stupid people out there who don't have pain making rules about pain. That don't get me started there. Okay, so there's a bias. It's as bad as being a black man in a 1934 KKK meeting. Okay, you're screwed. Don't be surprised that your supervisor, even your family, no one's going to believe you. Example, okay, I have a tall girl, a young girl who has a disc in her lower back. This is part of the lower lumbar spine, and it's pinching a nerve to her little toe. It's bulging out based on physical exam, because we didn't have MRIs at that time. So you had to do an MRI, a myelogram. You stick dye in there and see if there's a dent on the spinal cord. So I was in Pauls Valley. I send her up to a neurosurgeon. He does the myelogram. It's normal. And because she's on pain pills and stuff, families even write me letters. She's a drug addict. And every time I want to fire, the Holy Spirit says no. So I sent her a second time, and again, it's negative myelogram. I send her a third time, and he calls me back. Now, Ellis, I've done this twice, so I'm not going to do it again. I said, do I send you all the neurosurgery from Pauls Valley, Oklahoma? Because I'm kind of the default orthopod. Yeah. Is it over 100,000 a year? Yeah. You're trying to blackmail me. I'm glad you understand. Now, this is what you're going to do. You're going to have her stand for an hour. You're going to do the myelogram, and you're going to take that tilt table. You're not going to lay her down. You're going to stand her up and do the x-ray. And of course, she says she's got 2 huge discs, operates on them, and she's asymptomatic. Okay? Because that's the Holy Spirit kept me in this business. But her exam was that, and doctors rely on tests instead of patients, which is a dumb system. Now, I became a great doctor as a third-year medical student when I found out patients knew more than I did. Because what's sharp, what's dull, what's how, but you pick up vibes, and then a phenomenal doctor as a fourth-year medical student when I found out mothers and nurses knew more than I did. And in the 50-plus years I practiced medicine, the only time I screwed up when I forgot those 2 axioms. Classic case. Summertime, Rocky Mountain fever time. Mama, kids got bitten by a tick 2 weeks ago. He's acting funny. I can't explain it any better than that. Of course, the exam's normal. And I do the Rocky Mountain spotted fatigue test and all the other stuff. It's all negative. It started him on doxycycline, which can yellow teeth in a 10-year-old. A month later, we do the follow-up test. He had Rocky Mountain spotted fever. What if I did like most doctors, treated the lab test? 33% chance that kid dies, and 80% chance he's got brain damage and kidney damage. Scared the shit out of me. I don't treat lab tests. I treat patients.
So let's focus again back to the legal aspect of it. You mentioned that the 1960 Federal Workers' Comp, but VA specifically, they are specifically supposed to address the diagnosis and not make any determination in the claims process. Because you have the white coat, you're the subject matter expert, correct?
Right.
So
now the doctor at the VA, if a doctor sees for a C&P exam, they can make a diagnosis. Okay. But the rater is just supposed to take the records and go with it.
So let's talk about the difficulties in the actual rating doctor sometimes with filling out a DBQ, because these are short exams. And the individuals who may not have medical records, what do they do?
You need a medical nexus for the doctor to listen to you and take your history you told him and make that your medical record. The best medical records are the ones that got burned up in the fire at St. Louis, a bunch of VA records. So you come tell me what happened, that becomes your new medical history. Okay? And of course, no one goes to the doctor in basic. They're not going to repeat basic. And I can't get 101st Airborne Marines to even file anything because I've got too much testosterone. Okay.
So just to clear that up, if they don't have a medical record, but you put it in your document.
Oh, I make the diagnosis. I make the diagnosis. You need to understand, almost all diagnosis in medicine is hearsay. Objective, there's no objective finding on a migraine. So everybody with migraines is a malingerer and a liar. Okay. There's hardly any objective injury on a back. Okay, unless you have a reflex that's different. Maybe muscle spasm. Okay. And now the MRI doesn't mean that's it, what's causing it. You got to tie it all together. It's got to make medical sense. Right? So I'm always hearing lay people, no objective evidence. Well, then if you have migraine headache, bitch, you're a liar.
Well, if there's any questions on here before we wrap up shortly, please feel free to ask them. You're 81 years old.
82.
82 years old. You were 81.
No.
I'm trying to give you a year. Bear with me.
Okay.
All right. Is you still come to the office every day?
Oh, and let me tell you, if I stayed home 2 weeks, we'd be divorced. That's expensive. I'd go out of my gourd. I got up at 5 o'clock this morning to come in and fill out some forms because I'm always doing processes and forms. And I read in Bottom Line the other day that they're now doing studies on what are called super agers. They're always worried about dementia, but what about the people that don't seem to do that? One of the few common denominators was they didn't smoke, but it didn't seem to be anything. And so I've decided that my title is I'm a super ager with a modifier asshole. I'm a super ager asshole. And asshole is correct because my pretty wife, she diagnosed that years and years and years ago. You're getting paid to be an asshole, so I'm getting paid to teach it. And this lady is going to have a lot of jewels in her crown. My God, she's put up with me more than 60 years. Woo!
How does she manage?
I have no. Well, Jesus. I mean, okay. Now, this is advice to people married because we've been married 60 years, so I'm an expert. Now, without Jesus, it's not going to happen. Just forget it. If you don't have the Holy Spirit in you, it's not going to work. Okay, so in middle age, I start taking blood pressure medicine, coughing, and she said, honey, I've got to have a separate bed. And I pouted a day or two. Then I thought, boy, it's really nice to part when you want to. And at that age, you make appointments and I want to watch the John Wayne movie, or she may say, yeah, but don't wake me up. That's true love. Okay. So now the reason we're still married after 60 years, we have 2 TVs and 2 rooms. So my eHarmony's already written, grouchy old man looking for a good cook with their own remote control, send picture of remote control. That's the trick. Now, for women, let me tell you how to stay married. First of all, you've got to understand you married somebody missing 1/4 of a chromosome. You have 2 X chromosomes. A man's got a Y chromosome, an X and a Y. That's 1/4 of a chromosome. Man, that's Special Olympics. So you married a retardo. And so if you complain about your husband, you're stupid. No, this is how if you want to stay married, I'm going to write a manual, 41 pages. The first page is going to be a calendar. Once a month, say thank you for working. You don't have to mean it. Just say it. And the next one's a calendar. Twice a month, initiate sex. You don't have to wake up. You don't have to have orgasm. The next page, you are through. You don't have to cook. You don't have to clean. You are through. We are real simple. Okay. I need to be on the comedy club.
I'm afraid you might get canceled today. Well, all right. We have a question on YouTube from Hank. Have you ever dealt with MRSA eating away partial bone under?
Oh, yeah. Infections. Oh, sure. Those are easy. Yeah.
So what's the process for someone?
Well, it depends on the milieu. If it's VA, if it's federal workers' comp, if it's state workers' comp. Huh?
Or FEC?
Yeah. That's federal. That's federal. Yeah. Oh, yeah. Yeah. It's just like having brucellosis or any other disease.
All right. Well, if there are no further questions, we're going to end here 10 minutes to the top of the hour. Any last things? How can people get a hold of you guys?
ellisclinic.com. Read the stuff and just go to appointment and it'll tell you all the things you need to do. And when you send that stuff in, we look at it. Now, this is what I tell my staff. Don't trust anyone. I don't care what you want. I don't care what your attorney wants. We're going to figure out what the duck is, and then we'll advise you what we recommend you to do. Okay? We don't go by emotion, although I'm an emotional person. We go by what gets the duck taken care of. Right?
All right. Well, we'll be back here next month on the first Friday. And thank you for joining us. This is Doc Ellis fighting for you since Vietnam.
Oh, look at that picture. Look at that. He's not as fat as I am. Hey, I used to take care of an elephant in Vietnam. Yeah, that was fun time. Now, that's what's interesting. I realized, I loved the war in Vietnam, the mortars coming in, the crap, and all. I loved it 100%, and I hated it 100% at the same time. It's kind of like the Bible. It's 100% predestination and simultaneously 100% free will. Okay, we got it.
All right. Real quick, before we leave, Ray commented saying that we are backed up at the Ellis Clinic, that it takes about 2 weeks to get an appointment. Is that correct?
Maybe even more now.
Okay.
Okay, but now, I got a prayer request for everybody. I've got a large firm, investors, getting ready to send me an offer. So hopefully, quickly, we will quadruple size, have administration, and be able to open up the doors.
Hopefully the floodgates open and we're able to continue on the fight. Thanks everyone for joining us. We'll be back, as I said, next month, first Friday. Submit your questions at askdocellis.com.
Oh yeah, askdocellis.com. A lot of times Gary will answer them. I mean, you won't have to wait. Yeah.